Okay, we are live. It is 6:31 a.m. This is the 77th Coffee with the Commissioner. We appreciate everyone being up in the morning. And once we complete this discussion this morning, as we always do, we will tape this and record it, and it'll be posted on the county's website. So folks who aren't necessarily up in the morning can watch it at their own leisure. But today we're going to have a great discussion. A very important program was voted upon and funded at our last Board of County Commissioners meeting. And it's a topic that's really of national and local interest. It's a way that we can start to address this opioid crisis that we see nationwide and locally. And really the overdoses that we're seeing all over the place. It's been reported back to us commissioners that our EMS, ambulance, and paramedic units are responding to an average of 6 overdoses every single day. That's not counting the hospitals, what they see with buddy dumping and, folks drop off their buddy who's overdosing, and other facilities. So it's a big problem. And so we've got the experts here today. We're going to talk about this program that the state of Florida funded. Sadly, the reason they funded Escambia County is we were one of the, this is not the category that you want to lead, but we were one of the top counties where we, numbers and percentage wise, where we're having overdoses and deaths. So we got some state money, and the board voted for it, and Eric and his group is going to implement it. So this morning we'll change it up a little bit, and Eric, we'll start with you. It took us a while. We had it on the agenda. I want to say back in October, we dropped it, and then we brought it back and we approved it. Where do we stand right now with implementing that program?
Yes, sir. So right now we're waiting on the funding to come in. The scope of work was finally finalized. That took a little bit to get it done, thanks to Marie and her group pushing Tallahassee to get this thing going. But we was waiting for the scope of work. It was in draft form, and of course the board can't approve anything that's in draft form. So when that finally got done last board meeting, the funds should start funneling through Marie. Marie will kick the funds to us, but right now Torcell already has some of the equipment already identified, ready to go. And even though we had a little bit of a glitch the board meeting before, we went ahead and advertised for the staff. So we're actually in the process of hiring the staff, which will be the nurses and the EMTs that'll be out in the field doing the house to house or going to the homes and doing the program. So we should be interviewing for the staff pretty quick. We are hopeful we can get this thing up and going before the end of the year, if not shortly after the beginning of the year. So we're moving as quick as we can on this one. The whole project come together about June this year, guys. So about June. So from June to now is a pretty monumental task. And, it was a tough push to get that boulder up the hill, but this group absolutely did it, got everything lined out, got the scope of work, got it approved by the state. And I think as far as programs go, I think we're leading all the other programs right now as far as where we're at, the community partnerships that we've developed, and the actual scope of work that this group has put forward. So excited to say that it should be pretty quick. As soon as we get the manpower, I think Chandra's ready to go. I think Dr. Stavros is ready to go. They're just waiting on us. So unfortunately, but we're getting it. So we should be ready to go here pretty soon.
Very good. Fantastic. I had the opportunity to speak to Allison Hill last night at a function where she was, and I happened to be as well. And I was asking her about the other topic of interest, kind of dovetails with this topic, is the regional intake facility. And she seemed very optimistic. Of course, I certainly would never speak for her, but she seemed very optimistic that we were going to get that. And she believes it could come to fruition as early as this coming summer. So that would be that would be a fantastic thing. She also let me know that we do now have a detox facility here locally, that a 10-bed, they got that capability back. So that's great news. A lot of folks don't know that. I didn't know that, so I was happy to hear it, because I know that was something that has been discussed by David Torcell as something that we desperately needed. So we're going to get into all that, but I kind of jumped ahead with you, Eric, but I certainly don't want to jump over our County Administrator, Wes Marino. Wes, thank you very much for being here in the morning. I know I see your truck here and I'm like, man, but I appreciate you being here. And so what's going on in the county?
Quite a bit's going on here as of late. So moving into the new year for District 1, this is going to be year of the Perdido Bay boat ramp. It's going to be the year of Longleaf. We have Dunaway drainage project going on right now. And I believe we're going to see some good things at OLF 8 moving into the new year. But as the most recent, as you know, we've wrapped up our midterm elections. And so there's a lot of electricity in the building, a lot of excitement in the building. as we move forward. Next Tuesday, we'll be doing our installation ceremony. We'll be installing Robert Bender again, Commissioner Bender, for his second term, and I'd like to congratulate him. I believe he has accomplished quite a bit his very first term, and he's done a great job. So we're looking forward to another term with him. And then you have Commissioner-elect Kohler, who will be installed, and so we're looking forward to his public service and see how that impacts our community. But I think we're going to be great as we move forward. And then just in the community itself, there's been a lot of good things going on. You know, we had the Arts Festival, we had the Egg Fest, they've got Winterfest going on downtown. Downtown is lit up, the community's excited. Staff is excited about things as we're moving forward. So I think we're doing great. We're in a good place. And I think as we move in toward the holiday season, the first part of next year, you're going to see some really good things start coming together for us. And I think we're going to be great.
Fantastic. Yeah, that's a big deal. The boat ramp. My understanding initially, the bids came back, and our initial bids that came back were $700,000 below our estimate, which doesn't happen these days with the cost of materials and labor. And then come to find out, we weren't going to be able to go with that bidder. And the second one on the list came back, and I think it's right on the target. So at least we're not going to have to feed it with more money. But that'll be a tremendous asset amenity for the community down there on Lower Perdido Bay. We desperately, obviously there's a demand for it. You look at our existing boat ramps, they're packed out all the time. But that's a great one. That's a big win for District 1. It's a big win for the west side of Pensacola. I'm also excited about the fire station. I had the opportunity to drive by there. It's coming together. You know, these projects take time, but you could see the progress. Looking forward to opening that in a couple of year and a half or so. Longleaf is going to be a great big project, but you're right. The big news is next Tuesday we have our installation. Everyone, the public is invited, 9 a.m. in the morning. It's always a great thing. I know the school board's right behind us at 10, and I believe the city is right behind us at 11. So it's back to back to back. I'm going to try and get both of those as well if it's possible. So yeah, lots to be excited about, lots to be really looking forward to after the holidays into the new year with a brand new board. It's going to be fantastic. So appreciate all that. All right. Without further ado, let's just get into what we're talking about here. I mean, you know, everyone sees it in the news. Well, we don't see enough of it in the national news. Local news covers it, but we've got an epidemic in this country. The last couple of years in a row, we've lost, over 100,000 citizens to these opioids, this fentanyl in particular. And locally, as we discussed a little bit before the meeting this morning, our EMS units are responding to like 6 a day. And then we've got people being taken to the hospitals, dumped off, when they're overdosing, plus what the sheriff's office sees and other facilities. So we've got a pretty big problem here in Escambia County. And sadly, we're like the number one ranked county in the state. So we've got some Florida money that we voted on. And so we're doing this core project to hopefully address this addiction that leads to some of these overdoses and hopefully curb the number of overdoses. But I want to start out, I'm going to first introduce the panel, and then I've got a list of questions, and we'll just go around the room. And again, my thanks and my appreciation to each of you waking up early, because this is a topic of great importance. So our special guests this morning are Chandra Smiley from Community Health Northwest. She's the director. Thank you for being here, Chandra. Marie Mott from the Florida Department of Health at Escambia County. Thank you, Marie, for being here. I'm not used to seeing you without the mask. Good to see you. And I like your background too, but I think Dr. Stavros has you beat. I like the Blue Angels. Yeah, that's a good one. And then of course we have Dr. Mark Stavros from Florida West Hospital. And Dr. Stavros, is your specialty addiction? What is your specialty?
Yeah, so I'm board certified in emergency medicine and addiction medicine both.
Okay, fantastic. And I appreciate you being here. And then we were supposed to have Christine Jandora, but I don't see that she made it on the call. And that's too bad. She was from Ascension Sacred Heart. But we've got enough people here that we can kick this around and hopefully get some good answers. I'm going to throw this out to the group first. And we talked a little bit about this before we started, but can we address this crisis? It just seems to be such a perplexing problem. There's big litigation against the pharmaceutical companies, but there's counties, particularly rural areas out in the heartland, and areas like Escambia County, Florida, that are really having a hard time with this, with the overdoses and the addiction. Is there a solution to this? And I'll start with you, Dr. Stavros, given your credentials.
Yeah, I mean, I think we do have a solution. And I think really what we need to do is help educate people to what addiction is. I mean, addiction's been around a very long time. And obviously we're in the midst of a major crisis right now. But we do have a solution, and really it is taking some of the tools that we've had before in the past, behavioral therapy, motivational interviewing, really the counseling and stuff, but also we can add medications now. We've started to realize that addiction is not just a behavioral disorder. And we've thought about that like that for a very long time, but it acts more like a chronic disease. So you have to treat not only the behavior, but you could also target some of the medical issues as well. And when you do that together and treat it more like a chronic disease, you see better outcomes. So.
How often, I've heard, kind of veering off topic a little bit, but I've heard some of these drugs like methamphetamines, for example, are like 99.9% addictive. Even if you put a guy in jail for 5 years where he's not going to get it, when he comes out, the first thing they do is they go get it. And so is it realistic to say you could cure this, or are some of these things so powerful that you will never cure the addiction?
Yeah, and I think it depends on the person, Jeff. I think that, depends on the medication, how long they've been using it. And some of this can be treated, but most of it I really think it's important to understand that most of this needs to be seen as, we don't just detox people immediately and say, hey, here's some tools and good luck. Really, when we're starting to use medications for somebody that has pretty long-term addiction, at least over a year of addiction, because they've created tolerance to it, they've created pathways in their brain that, when times get tough, what do? You use. And so we're trying to give them other tools. But in the meantime, if we can stabilize their brain to a point where they can actually create those new pathways, they're going to have better success. And so sometimes, if you look at the Surgeon General's report, he also confirms that the longer that you're in treatment, the better your chances are going to be and your less chance of relapse. And so relapse is always a possibility in the future. We're just trying to decrease that percentage for that person. So again, to your point, do you cure diabetes? Do you cure hypertension? You really don't. I mean, you manage it. And I think that's what's important to understand. We manage that with or without medications, but it's going to be a long-term management process.
What a great point that is. What a great point. Well, Chandra, I'm going to kick it to you now, because one of the issues that I think folks might run into is you're between jobs. You don't really have good health benefits. You got a problem. What do you do? Is that where Community Health Northwest can step in and help folks who don't necessarily have good insurance or any insurance? How do you guys step in and help those folks?
So that's an excellent point and question. As a federally qualified health center, we receive funding to offset the cost for uninsured patients. So we're here to take care of anybody who walks through our doors. Our role with the core program is, once an individual has agreed to enter into this program and is being prescribed Suboxone, there is a warm handoff to Community Health for continued maintenance. And it's not just maintenance of Suboxone, it's also looking at the overall health and wellness of that individual. So there is the primary care services that will be offered in addition to the behavioral health and wellness support programs that we have, but all other service lines, optometry, dental services, women's health services, and really engaging that patient and engaging that entire family unit so that we're taking care of the whole person and their whole family as well.
And if they don't have the best of insurance or any insurance, there's a way you can get them in there. I've heard anecdotally that the Suboxone is very expensive, but you've been able to channel your resources to get it for about $30 a dose. Is that accurate, what I've heard?
That's exactly correct. Because we are a federally qualified health center, we receive a benefit, a pharmaceutical benefit, and it's 340B pricing. So we're able to purchase medications at a much reduced cost. And what that allows us is the opportunity to pass those cost savings on to our patients. And depending on our sliding fee program, on where the patient, what category the patient falls into, in some cases, Jeff, we're taking care of the medication entirely. So there is no cost to the patient.
That's fantastic. That's good to know, because I guarantee you there are people out there working perhaps a job that doesn't offer benefits, maybe service industry type of jobs, and they know they need help, but they probably don't know. And I just don't know. How do you get the message out about your program, Chandra, to folks who may not know about it?
Well, here in the last several months, we actually have created a communications department, which is something we've never had. So we're doing a lot of social media push. We've done some awareness campaigns, but certainly, a campaign around access and how to apply for those that sliding fee program is a campaign that's on our radar.
Fantastic. Marie, you run the health department here in Escambia County, Florida. So what sort of programs and services does the health department offer for folks who find themselves in this sort of a predicament where they're addicted? They know they are. Is that something where you work with Chandra or you work with Dr. Stavros in the hospitals? Tell us about what you could do for folks who are in this predicament.
Well, a couple of things. One is, we've definitely worked to pull together this partnership to implement this community wide. And so, I think Chandra is going to be kind of the main point of care for, her organization will be providing that. We do offer some primary care services and other things at the health department, such as the WIC program, for example, that, Chandra's team could be referring out to as needed. Also, we have recently received into our health department, as well as all the other health departments statewide, Narcan for distribution. So that's kind of the initial part of this program is rescue response. So Narcan would be one of those things that someone could use to help another person or to help themselves. I suppose you're not going to really do that in that situation, but to have it handy in case it's needed. So that is available to the public, that they can come in and ask for it. There's no questions asked, no identifications required. We just have to track what we give out from our inventory, but that's as far as we go. So those are some examples of things that we have at the health department.
Well, Marie, let me ask you more about the Narcan, because for a while there, up to about 2 years ago, the closest place to get it for the general public was in Walton County. And then I know that the Health and Hope Clinic, where my wife is the executive director, they got a grant from Impact 100 and they began distributing. They've given out over 1,000, well, probably 1,200 doses. And they have heard back anecdotally that there's been several dozen lives saved from just the doses they've given out. They've given doses to the sheriff's office. I'm glad to hear you're giving it out too. I didn't know that. That's fantastic. I heard that Santa Rosa County Health Department was going to start giving it out. So that's fantastic. And that really, can I ask you, and I don't mean to put you on the spot, although, sometimes I do, but so we've known about this crisis for a long time. It's been years and years, tens of thousands, hundreds of thousands of people dying. Why is it that we're just now getting the Narcan through the health department locally? Was there some holdup? Was it a supply, or what do you think the cause was for that?
Really, I don't really have an answer for why. It has recently just been a program that was developed and funded at the state level and pushed out to the counties.
Okay.
So all the counties, again, statewide, are going to be receiving Narcan in for distribution. And we just have received ours in and have kind of started pushing it out. So,
well, I'm gonna throw this one to Eric. Eric, I'm gonna throw you out of your comfort zone. This is a question from online. Why does Escambia County have such a high number of addictions and cases? I mean, you know it. You hear about the reports from the ambulances and the EMSs, but I mean, what's your opinion on that? Why do you think we have so much and other places don't?
I truly answer that. I mean, I don't know, but I guess it's the availability and the easiness to get. And we do have I'm not going to say it's going to be all homeless and everything, but we do have a rather large homeless population out there as well. But it's something that we've seen for years in Escambia County EMS. Just here recently, I guess, because of the traction and the reporting and starting to track this stuff, we're seeing an exponential increase in it. It could be COVID. It could be COVID related. It could be depression. It could be seeking other means to escape reality. So a culmination of things: depression, severe depression, and it's just a way to escape reality. So the current state we're in with COVID and coming out of COVID, and a culmination of things. So, but I think the availability of it and the easiest. I mean, you see down South Florida, they had a huge fentanyl drug bust down there. I mean, huge. So I mean, and you see how easy that was, and it's just in simple pill form. And of course, now they're marketing those things to make it look like little M&Ms or Skittles or whatever. Like, yeah, exactly. And then they're lacing it with, you know, they're using fentanyl to lace with marijuana and everything. And now we're getting people who never intended to use fentanyl. And we're going to call several of them who marijuana users or whatever, and it's been laced with fentanyl. Now they're a statistic of it. So we're starting to see a increase in that. So I don't think we've seen previously that type of stuff in the county, and now we're starting to see more and more of that because it's just so easily to use fentanyl and cut other drugs with and lace it in your marijuana and everything else. So
let me ask you, are we still seeing about 6 opioid overdose calls a day in Escambia County from our EMS
that's a
unit?
fair assessment. Yes, sir, about that. I mean, yes, sir, we are seeing that. So the teams get out there, it goes out as cardiac arrest, they get on scene, they identify it as a overdose. Sometimes the caller calls in and tells us straight up, it was an overdose. And those are helpful because now the crew's mindset is geared toward, okay, I'm going to hit them with Narcan, I'm going to do this. And but when they get there and it's just a cardiac arrest, and then you see some of the paraphernalia laying around them, or they're a familiar face that we've run before. And
I was going to say,
we
you have
know the
frequent
history.
flyers. You have frequent flyers, don't you?
Exactly. So that's exactly right.
Well, I'm gonna throw kind of an uncomfortable question to Dr. Stavros. And again, man, I appreciate you being here, but why do you think, number one, that we have such a problem here? And one of the policy questions that's gonna bubble up, I see at other places, is this idea of safe spaces for folks to go shoot drugs up or take their drugs or whatever, so that if they overdose, there's someone there who could help them. I'm really conflicted on that because in a sense, they're going to do it. You don't want people to die, but you're almost condoning the behavior if you set such a thing up. If you don't mind me asking, of course, you don't have to answer, you're under no obligation, but given your background, if you're a policymaker like me at the local level, would you support such a thing?
Yeah, that's a great question. So I think I'm kind of with you. I struggled for a while trying to figure out where do I stand on that issue. And I probably stood on one side more than another. And I think I've transitioned to a different side. I think of it almost like Narcan in a sense. I think if you're just giving it out willy-nilly and not supporting it with anything else, no counseling, here it is, it's just harm reduction, pure and simple. That's all we're going to do. There's a certain component to that that's actually helpful. We're going to keep people alive, right? So Narcan, we give it out. We can give it out like crazy. There's harm reduction with that. It's not a cure. It's an antidote to an overdose. It's not recovery, right? Recovery is a program where you're trying to work that as well. But I'll just tell you right now, if you have a dead patient, then none of that really matters.
Right.
So we have to keep that patient alive no matter what. Just looking at it from an economic standpoint, if you were to have injection sites, safe injection sites, I mean, the amount of hepatitis C and HIV and STDs, everything else you can imagine that go along with that is unbelievable, the amount of cost that is. Endocarditis, I mean, changing a valve of a patient is hundreds and hundreds of thousands of dollars. That's coming right from injection. If that person were injecting something safer and not getting endocarditis, that literally saved all the taxpayers hundreds of thousands of dollars for that one patient. Getting patients into, and I think it's important, like we might offer you a safer alternative, but at the same time, we're also going to offer you the ability to get into recovery too. So you partner with people like Chandra and the FQHC and say, listen, we would like peer support there. We're not huge fans that you're using drugs, but we want you to use it safely. We're going to show you how to use it safely so you're not going to get infected by something, or you're not going to infect other people too. Because I'm going to tell you, one hepatitis C person is probably going to infect 20 others. And so it becomes this huge cascade. If we could stop one person by not allowing them to get hep C, by at least showing that we have peer support here that care about them, and actually anytime they're ready to get into recovery, hey, let's help you warm handoff over to Chandra and get into long-term recovery when you're ready to do that. Because I'll tell you, it's very hard to force somebody to get into recovery unless
you can't help them unless they want to be helped. Well, what a fascinating response. And I hate to put you on the spot and answer the question, but you answered it beautifully. So you're conflicted, but you're kind of transitioning to the idea that it perhaps could be something beneficial just because it solves a lot of these ancillary infections like hepatitis and endocarditis and these other things. And that achieves a tremendous savings to the system. But if you're me though, how do you explain that to Joe Public when they're like, oh, you're going to spend tax money to let junkies shoot up? And, people can be very callous in what they say to a county commissioner when they don't agree with something, believe me. So how would you just answer it the same way? Because what you said makes perfect sense, but then there's the moral aspect of it too. Would your pastor approve of what you're doing? I'd like to hope that he would, if we're saving people's lives. And like you said, there's such a stigma to it, but you're telling me this is a disease. These folks can't help it.
I think that's an important thing to say. I mean, pretty much what I said really is the approach you need to take about just taking care of humans, right? Taking care of each other. We care about you as a person. No, I'm not happy the fact that you use drugs, but I care about you enough to do something about this and try to help you. And then also learning about the science behind this. When we look at addiction and understand that it's a disease of the brain. And if you look at somebody that you're like, well, why would you just use this again? I mean, you might lose your children or you might lose your job, and yet you still choose the drug over that because something's happened in their brain. And for us, we look at it like that was just a bad choice. Well, in their mind, after a period of time of taking these drugs over and over again, they've created pathways of saying, this is the most important thing in life. This is almost as important as taking a breath, right? And if I don't take this drug, I feel like I'm going to die. And your brain is telling them, yeah, you need to take this. It's a matter of life or death. And from us, from the outside, we look at them like, that's nuts. How could you possibly make that choice? But their brain is changed to a point where that is the most important choice. And so we need to help them. And that's what some of these medications do. It helps stabilize the brain to the point where they're like, wow, I'm not having cravings anymore. I'm not in withdrawals. I'm just feeling normal again. And I'm not, I'm not trying to get high anymore. I'm just not wanting to be sick anymore. I just want to be functional and I want to get my life back together. When they're ready for that, we want to be there to go ahead and help them get to that point. And so, the injection sites, it's a tough topic. I got to be honest with you. I don't envy your shoes because that is something you would have to sell and it would take time. And just like me, I mean, I had to see it. I had to see the science behind it. I had to see the compassion behind it as well, and understanding the big picture that ultimately this really is the best thing for the community, not only for that person, not only for all the people that ever touch that person, but the whole community in general. That's actually a benefit.
I appreciate your answer on that. One of the things I'm passionate about is, of all things, animals. And I've worked real closely with Director John Robinson because we want to, at one point in our shelters, we were killing 60, 70% of the dogs that came in. And I want to, it's just a heartbreaking thing. So we spend money. We're now to a point where we're not killing dogs unless they're vicious or dying. And if it's so easy to worry about saving the dogs, I mean, I guess I shouldn't be hung up on, because we're talking about human beings now with this program. So, I'll look at it very, very closely when it comes, because I know it will come. And I don't even know, Wes or Eric, if that's something we could do unilaterally here, or is there state laws that regulate it? It's that could be a political lightning bolt. I mean, I don't know if we would I'd have to ask Allison Rogers that, but I'm all about saving people, especially people who have a disease and can't control it. So on that note, I'll segue over to Chandra and Marie. What do you do with someone who feels it's a stigma? I have this position here. I'm a person of maybe some influence in my company or within my church, and I've got this secret addiction. How do you break that stigma and convince someone to come get help? I mean, or can you even do that?
Well, I think that, like Dr. Strabo said, when they hit that point where I just want to survive, I don't care about the high anymore. I'm just trying to feel normal. I think that's the opportunity to engage in a meaningful conversation to get someone to that place. I think we've talked a lot about addiction being a medical condition, and it's not a moral issue. It's not a failure, a character flaw. One of the things when you were talking earlier about policies and getting the community to buy into a harm reduction program, Huntington, West Virginia, we had the opportunity to speak to some individuals who were part of creating a continuum of services for the residents in Huntington, because they were experiencing the same type of crisis that we are. And where they started was with the faith-based community.
Yes.
They got the faith-based community engaged. and did an awareness campaign around this being a medical condition. And when the faith-based community embraced that and understood it, then deploying harm reduction programs, it was easier for the community to wrap their heads around and to accept. And so then it made it easier for policies or codes to be addressed or changed or developed.
No, that's a great point, because a lot of these services are provided by faith-based groups. And is there ever any kind of pushback to that? Because I know there's a segment of the population that really wants a clean line between any federal money and a faith-based group. I'm not that person. Obviously I understand that a lot of federal money goes to private religious institutions in the forms of student loans. And I'm not that person, but is there ever any pushback to that, Chandra? Have you seen?
Well, I mean, I think that engaging the faith-based community, it's not around, it's not so much sending federal funds into those organizations. It's just engaging as partners and understanding that we're all in this, we're all in this together, and working together, we can make a difference for those that are struggling in our communities. And so that was the angle that Huntington, West Virginia went, was that we've got to engage these key stakeholders, where people who are in a moment of crisis, they're going to seek clergy, they're going to go to the churches. And so if the faith-based community was educated and ready and prepped to be able to counsel and understand that this is a disease, it just made that community coming together in a seamless fashion much easier.
No, that's a great point. That's a great point. Marie, what is your answer to that? I mean, you're at the Department of Health here in Escambia County. You see all kinds of stuff. How do you get past the stigma, in your opinion, in your professional opinion, doing what you do, of this addiction? If someone's on the fence about actually getting treatment, or they think they can control it, or they can manage it, and now with these deadly drugs that cause overdoses, what would you say to someone who's on the fence about getting the treatment that's out there?
Well, I think it's going to be hard to add to what Dr. Stavros and Chandra have already kind of put together, but really just to kind of reinforce, like Dr. Stavros said, it's a change in a disease of the brain, or a change in how the brain functions. Just like somebody has diabetes, there's a change in how their body functions, and we treat that. And just somebody has kidney disease, there's a change in how those organs function, and we treat that. So it's a very similar kind of concept. It's just newly applied in the public realm. I guess we're not really used to thinking of it that way. So a lot of education, like Chandra had alluded to partners, to community members, to the public in general, to help kind of shore that up and increase that understanding.
And what concerns me, obviously, I spent several years, a lot of years on the school board, and we had a lot of programs. We had DARE, we had the police officers coming into the classes, we had Red Ribbon Week, we had all these well-intentioned ideas to kind of teach kids, that just say no to drugs. Everyone remembers that. I even remember the egg in the frying pan. Hey, this is your head on drugs or whatever. But it just appears that none of it's working. I mean, is that a cynical perspective, or is it reality when we're losing 100,000 citizens and they all grew up in the same place I did, watching stuff, Red Ribbon Week, the eggs burning on the skillet? Marie, I mean, did it work? Did the war on drugs work, or in your opinion? I know that's kind of a heavy question. You don't have to answer it. I just figured I'd throw it at you.
Well, and just to kind of bring back to the CORE program, this program was based on a model that was started in South Florida around 2020. Palm Beach County put this kind of model into place, and kind of the idea is, trying to find a new approach. It's been a very successful approach. So they've taken pieces of the war on drugs, I guess if you want to call it that, that have been implemented, and kind of pulled them all together into a system. So you have the rescue response, where EMS, treats the patient, Narcan's administered, they get into the ER, they get stabilized in the emergency department, and then connected, not just referred, but connected to a long-term care treatment. So this is kind of the model that we're building on here in Escambia, and it's been very successful in the South Florida area. We've kind of looked at it as partners in the community and kind of built it based on our community. So it's not exactly like what's implemented in South Florida. We try to customize it. But that's kind of how we've come to this approach. So what's been done historically has not been as successful. So trying something new is the next best thing.
Yep. No, that's a good answer. And, I guess I would ask, there's obviously metrics that have been used in Palm Beach County and South Florida where this program originated. And I would assume it's like a reduction in the number of overdoses, perhaps. I'm sure there are metrics that y'all have looked at that lead you to believe it's been super successful. Is that right?
That is, and I don't have those written in front of me.
No worries. Hey, I got a really interesting question online. It's for Eric and the doctor. So there's an unwritten rule among cops. That's too bad we don't have the sheriff on. There's an unwritten rule among the cops that they don't make arrests on drug overdose calls, scenes, even though they find the drugs and the paraphernalia. They say if they did prosecute, the people wouldn't call for help and more people would die. Is this situation creating more frequent flyers for us, Eric, and contributing to the vicious circle? I didn't know that. This is just a commenter online. I don't know if there's any truth to it, but is there any truth to that, Eric?
I don't know if that's 100% accurate. I'll run that one down. I'll get with Sheriff Simmons and absolutely ask. But I know when we run the overdoses and we transport to the hospital, there's no law enforcement there waiting for them to come out of the hospital and hook them and book them. So I do know that, but if their sheriff's on scene, I don't know that they are not prosecuting down the road or whatever. It may be a one-off, may happen more frequently than not, but I'll find out with Sheriff Simmons about that. So
well, now I got another commenter saying, yes, that's the Good Samaritan law. And I think I've heard of that, but I guess that would apply to someone who makes the call like, hey, Scooby-Doo is overdosing and I'm gonna, even though I'm a doper,
That's
I'm
correct.
a drug addict, I'm not going to get arrested because I'm the Good Samaritan. So I'm the Good Samaritan, so I don't get arrested. But Scooby-Doo has got a needle in his arm.
Right.
I'd like to think that you'd get arrested. We saved
Dr. Stavros has got it.
Oh, Dr. Stavros, you might have an answer. Okay.
Go ahead,
I'm
you're at the
listening.
hospital, you see it. So
So I think this kind of segues to what Maria was just talking about as well, and really, about the war on drugs, right? So has it helped? Well, I don't know. You tell me. 15,000 overdose deaths in 1999, and we're over 100,000 now. So I don't think it helped. I think there's components to it that actually make sense though. And I think there's a missing component though too, like treatment, right? So we're not going to arrest our way out of this. And so even with the cops, let's say they do go and they see somebody that's overdosed, thank God they actually say, let's call 911 and get into the hospital, or even better yet, give them Narcan, save their life, then call 911, so I think they can be an incredible community partner. And so I think people do need to feel safe saying, I need to call whoever it takes to get somebody here to help my loved one who's overdosed here, without the fear of knowing that, oh, now they're just going to be punished. And, punishing this as a bad behavior, like we just talked about addiction, right? If we think of this only as bad behavior, I think we're missing a lot of this. And so we're not saying everybody gets a pass, right? There's no organization called MAD, like Mothers Against Diabetic Drivers, right? But
I don't think so.
There really is. There's a lot of stuff that goes around with addiction that has to do with some illegal activity. We're not giving them a pass, but we also need to understand that, hey, there's something else going on in their brain that caused them to do this. And just arresting them and punishing the bad behavior is not going to actually get us to the point we need to be. We need to address it as a community, saying, we realize this is a disease of the brain. We realize what you did was not okay. We don't want you to do that again, obviously, but we want to get you the treatment that you need that's going to put you in a better place to not do these things in the future. So,
no, that's a great point. We talked a little bit about this before we went live, guys, but to me, I have a big problem, and this is kind of going to be an open question to anyone who dares to want to answer it. But the national media never talks about this. I mean, if we're truly losing over 100,000 a year, which I'm to be told that that's true last 2 years, and we're on track to do more this year, 100,000 citizens is the equivalent of a jumbo jet with 300 people crashing every day. If a jumbo jet with 300 people were crashing every single day, the national media would be covering it. It would be, but you don't hear anything about this on the national media. I watch David Muir, and he has a serious face when he talks about monkeypox, the war in Ukraine, things that don't mean anything, but we don't talk about things that are important. And I'm just curious why that is. I mean, local media will cover it, but even them, not really very much. But we're losing a lot of people. I mean, every year we're losing more than we lost in the entire Vietnam War. And yet it doesn't get covered. We talk about RSV and hospitals being 80% full, and then latest snowstorm coming across the country. Dr. Stavros, why is the media ignoring this elephant in the room?
Yeah, I got to tell you, Commissioner, that wants me to pull my hair out too, because
I already pulled all mine out.
it's crazy. You know, you're watching the numbers and the COVID deaths and things, and I'm thinking to myself, my gosh, we're losing people like crazy every day from overdose, and nobody's talking about that. And not only that, it's getting worse. And so, you know, I don't know why it's not being discussed more. It is a little bit depressing to hear about this, but it's not sensationalized like other things, unfortunately. But we do need to actually address this, and we do need to put this at the forefront and help people realize that it's a big deal. I am going to say that at least, I mean, we're talking about getting funding for a program, which is fantastic. So it's not hitting deaf ears. Somebody's listening, and we're doing something about that, and enough's enough. And so we're going to actually put programs in place. But I'll let Chandra and Marie kind of comment from there. So,
well, if they want to, I mean, look, it could be a political question, but it seems that they have favorite things they like to talk about, and this isn't one of them. And Eric wants to say, okay, Eric, you're recognized.
I don't think it's that political. I'll be honest with you. I don't think, unless it impacts you personally, you don't care about it. And the reason I say that is because I had one of our media outlets here locally in Escambia County who put up the CORE program and talk about the opioid crisis and what we were going to do. And he had more hits on the mini cheer camp than he did on the CORE and opioid program, because it doesn't affect me. If I don't have any personalization, or if I don't have any family member or anybody, if it's not in my family or around me day in, day out, people don't care about it. But people need to understand that it does impact them at a distance. It doesn't impact them immediately in their life, but it does impact them in the way we do healthcare and the way we run our EMS system and the way we give resources out. So they take away resources from somebody who's having that cardiac arrest. So, but people need to realize those things. So if it's not impacting me, or it's not personally impacting me, what do I care about it? That's somebody else's problem. So that's just my thought. So.
No, I love that, because your perspective is perfect. We had that incident, and I'm not going to, get into it too deep, but we had a patient that was having some issues medically at a restaurant and made a call. And at that same time, we had a car wreck, and I think we had 2 overdose calls. So yeah, when grandpa's having a heart attack or grandpa has a headache and we think it could be something, but all our EMS units are treating people that are addicted and overdosing. You're right. It did affect you. You just didn't know it. It took extra time for the ambulance to get there. That's a big deal. That's a huge point that you made there, Eric. And I hope people realize that we do the best we can to triage. I know that your guys and David Torcell, they've got a system, and it's the alpha level. And then, you go down the list, but look, there's only a finite number of trucks rolling. And if we got 3 or 4 of these overdoses, it's not like you're not going to go there. And then, we got a heart attack over here. It's a problem. So Chandra and Marie, I want to ask you this. It's the same question. So why is it that you think the national media does not cover this? They just don't. I watch the media. I watch it very, very intently. It's not a topic they talk about at all. Why is that?
Well, in my opinion, and I go back to what we've hit on earlier this hour, and that's it's not a medical. The masses do not consider this a medical condition. It's a moral issue. It's a character flaw. So it's easy to say, well, that's a piece of the population that we don't really want to acknowledge or identify with because it's negative. That's my take. I don't think monkeypox could hit, I guess, anybody. COVID could hit anybody. Things that are, as Eric was saying, if it doesn't really impact me or connect to me, then I'm not going to necessarily pay attention to it. And so we have a long history of drug addiction being a moral issue and a behavioral problem, and not treated or recognized as the chronic medical condition that it is.
That's interesting. Yeah, you're right. For many years, the stigma was you're just weak. You can't kick it. You can't kick the sheets and get off of it. You're weak. But in reality, as Dr. Stavros said, it's a disease. They can't help it. Very
And
interesting.
it's a lifelong management of a disease. So we have a history of go to detox for 30 days and here's your tools and good luck. And if you can't cut it, then that's on you.
That's interesting. Marie, is that your assessment as well? Do you think it's just something that's not, they don't, and when I say they, the people in the national big media cabal, they don't think it's something that resonates with people. So therefore they're just not going to cover it and ignore the jet crashing every day. Because that's what they're doing. They're ignoring a jet full of Americans dying every day when they don't cover this. What's your thoughts on that? Oh, I can't hear you. You got to unmute your mic.
Got it. So it's possible that concept doesn't occur to them in that perspective. So, just given what Chandra and Eric had articulated, that's kind of, I think, the way a lot of people look at it, and not looking at it holistically as the whole number of people every day that we're losing. So there could be a lot of reasons, but.
Well, and that's not really a fair question to ask you guys, because it's really more of I'm sure we each have our opinions about what gets covered and the reasons why. But one thing that's important to me, and I don't know that it's a metric that's measured, but I was talking with Debbie, my assistant here this morning before we started the coffee. And, when we talk about all these deaths, over 100,000 a year, and it's a tragedy, and these are all people's sons, daughters, brothers, husbands, wives. They're human. Like you said, Dr. Stavros, are human beings. But is someone somewhere, maybe the CDC, keeping track of where the source drugs are coming from? Is it fentanyl? I hear that name a lot. And is it the illegally made or imported or manufactured, or is it could it be other drugs that are legally prescribed and they're killing people, like all the litigation that's covering right now? How many of these deaths is attributed to stuff that's coming over the border illegally? And does anyone keep track of that? And I'll start with you, Dr. Stavros. Do you know?
Yeah, the vast majority of it is made in clandestine labs. I mean, we have drugs that are on the street. There used to be pill mills and that kind of stuff that actually kind of gone away. We've had different waves of this overdose crisis. Initially, it was pills coming from pill mills, coming from doctors, coming from pharmaceuticals. And then as they started going away, we started seeing a real influx of heroin. And so black tar heroin, we saw a pretty big influx there. We started seeing the overdose rate go up there. Well, distribution of heroin was a lot harder during the pandemic. And you had this introduction of fentanyl, which is a completely synthetic. You don't need the poppy seed or the poppy plants to create heroin. That might be harder to get to, a little bit bigger process. So I can actually just make fentanyl in a lab, so whether that's China or Mexico, these clandestine labs can create it, and they can create it pretty cheap. And the potency of it is, 50 to 100 times stronger than heroin.
Wow.
So now if you're trying to traffic drugs, it's like, well, I don't need to take this huge pallet full of heroin and try to traffic that. I can put it in an envelope basically, and sometimes even in the mail.
Right.
So it's easier to traffic. It's definitely the stuff that people are overdosing on from a fentanyl standpoint is not pharmaceutical grade. It is actually made in a clandestine lab. It is illegally made, and it's distributed out on the streets in that form. So I'm not a cop, but that's the research that I've looked at and realized that's where it's coming from.
Yeah, see, maybe that's the reason it's not being covered, because there's a lot of folks that believe a lot of this is coming over the southern border. And you watch any of those shows on the Learning Channel or Discovery, and where they go undercover with the people and they body pack the drugs, it's happening. So maybe that's why they're not talking about it. Well, we've talked about a lot of stuff, but I want to get into exactly what the core program is going to do. So I'm going to go, Chandra, to you. Once Eric and we get our funding in order, can you walk us through the steps of what this program that we're modeling off of Palm Beach in South Florida have been so effective down there, what that will look like in Escambia County? And I'm going to step away just to close this curtain real quick while you start your answer.
Okay. So, step one is in the emergency room. So someone's been brought in as an overdose. They're offered this program in the emergency room, and they are given, if they agree, they're given their first dose of Suboxone in the emergency room. And then once they're discharged through EMS and paramedicine, they'll be connected with each day with their daily dose of Suboxone for up to 7 days. And during that time, that's when there's a warm handoff between EMS and community health. We have a peer counselor who will go out with the paramedics and meet with our patients and go ahead and make that connection so that there's a friendly face when they do come to their appointment with us. As part of the core program within the walls of community health, we have a licensed clinical social worker with addiction experience and certifications. I've recently brought on a psychiatrist who has a long history and experience with addictions, who will be kind of overseeing the medication management for this pharmaceutical piece of it. We've got health navigators in both Baptist and Ascension emergency rooms. We're in the process of hiring a health navigator to be at Florida West Hospital so that they can help be a part of identifying and connecting patients into the program. And then we have all of our primary care providers. So once they get into our program for the behavioral health and wellness piece of it and are managed through by our psychiatrists, then we're going to link them into a primary care provider as well. So that, again, going back to taking care of the whole person, making sure that from a health standpoint, if they do have hypertension or diabetes or some other conditions that need to be addressed, we can take care of that simultaneously.
And does all that apply to a person, whether or not they have Platinum Blue Cross insurance or they're a mechanic with no insurance? Does it apply to anyone who needs this help?
It applies to anyone who needs this help.
That's important to know. That's important to know. I want to always ask this question too. Is there as part of the core, Marie, is there going to be a schools component? I know that each school has a health tech. They used to have nurses. I think they have health techs or nurses in each school. Is there going to be a component to any of this that allows for students to make the call? I think that's important. I think there are probably some students that struggle with these issues. They're not going to tell their parents. They're certainly not going to tell their teacher. But if there was a phone line saying, hey, look, oh, and is it confidential? Is this all confidential, like protected by HIPAA? If a 17-year-old needs help, he's addicted, can he do it without his parents knowing? Or do his parents have to know? I mean, it's kind of a sketchy question, but I'm just curious.
Sorry, I somehow have lost my voice this morning. So what we are implementing right now is kind of a basic model for the core program. There certainly are opportunities to expand that. So there's not a focus on that question, I suppose, at this moment. But that doesn't rule out the possibility of this kind of things being implemented after launch.
I just have a heart for kids, and I know that they deal with so much already. And then just imagine if they've been given stuff that gets them addicted, because Dr. Stavros, that could happen, right? If they are smoking weed that had been cut with some of this powerful stuff, could that cause an addiction that they didn't even think they were ever going to have?
Yeah, I think that's a great point. The chance of overdose, obviously, immediate overdose is really the biggest risk, because they could get, who knows what they're going to get inside. Maybe they're smoking weed or something like that. But if you're a dealer, right, what do you want? You want more clients. And so if I'm giving you marijuana, you're probably not going to get addicted to marijuana. But if I put some other stuff in there that's a little stronger, and I get you somehow over a period of time addicted to something stronger, hey, I got somebody who's going to be there forever now,
That's right.
But, that is what you're thinking as a dealer. You want to make sure that more people get addicted, because that's how you make a living. And so it's awful. And
it is awful.
Unfortunately, it's kind of what's happening out there. So,
well, and not to get too crazy, but I love it when I talk to people who say, oh, it's just a victimless crime. We shouldn't prosecute these drug dealers. That's ridiculous. Remember, the jet's crashing every day, right? And I've seen stuff in schools, reading these discipline reports and some of these kids, what they've dealt with. And it's a horrible problem in our country. And that's why I asked that question earlier about the war on drugs. It's easy to become very jaded and cynical and say we failed. But I want to save as many people, citizens, students, kids, as we can, no matter what we got to do. So I can't believe how fast an hour goes. Again, I want to reiterate my thanks to each and every one of you, not only for getting up early and talking about this, because there are a lot of people going to watch this and get some information perhaps they didn't know, but for what you do in the community. Thank you, Dr. Stavros. You really opened my eyes on some things, to be honest. Maybe I was one of those guys who kind of thought, maybe these people are weak, they can't kick it. I mean, you got to think of it as a disease, I suppose, and just appreciate your perspective. Chandra Smiley, what you do, what you did through COVID, what your organization does, You're a superstar. Thank you for what you do. And Marie Mott, thank you. You jumped into your position. Boy, Dr. Lanza gave you a handoff, didn't he? Right in the middle of COVID and all the meetings you came to and all the grief the board gave you. Just appreciate you hanging in there. Of course, Eric and Wes, I know what you guys do day in, day out. So I appreciate each and every one of you for being here. I just want to go. We've got enough time for like a minute each. And I would like to ask this question of each of you, and just, give me about a minute if you can. What do you tell the people of Escambia County when they ask you, can we fix this? What's your answer, Dr. Stavros?
Absolutely. I think as a community, we can address this as we realize what addiction is, that it's not just a behavioral moral failing, that we actually can do something about this. I think if we understand that as a community, we can make a huge difference and come together and fight this.
Chandra, what do you think? That same question. Can we fix it?
I would echo Dr. Stravos, but I would also add that the core program, it's something that we haven't done in Escambia County. And so this is a new program. And I think that we're going to have some big wins with it.
I love to hear that. Marie Mott, can we fix this issue in Escambia County? Can we at least get to a point where we're not number one in overdose deaths? Can we fix it?
Yeah, I'm going to go along with Dr. Stavros and Chandra. I think we have a really good model that we've built with our partners. I think we probably have the best model in the state. We're the only county that has all of our hospitals. We haven't had three, but all the hospitals in the county participating in the program. And Chandra and Chief Torcell have really done a lot of heavy lifting to pull together the parts that they're going to implement. And as we get it launched and established, then we'll be looking at, how can we remove other barriers for other people to get into the program and be successful as well.
Right on. Okay. Eric, can we fix this? What do you think? You see the calls every day. Are you as optimistic as the others?
I am very optimistic. As I said, this is a new program for Escambia County. I think the community partners and everybody that's been pulled together have their own little piece that they are responsible for, and they're going to step up and get it done. And with everybody collectively working together, and as Dr. Stavros said, educating the public on what is addiction, make it meaningful to them, make them understand how this, how addiction is and how it affects them. So I think with the education piece, with the core program and the funding we're getting in and the community partners we have, I think absolutely with all these pieces, we can make a difference.
Well, I certainly hope that you're right. Wes, what do you think? I mean, you've been watching the whole thing. I'm sure you have an opinion on this. You've seen a lot in your 35, 36 years here in Escambia County. Do you think that, applying these sorts of solutions will lead us to fixing the problem?
Yeah, absolutely. The other thing that we have going is the Opioid Abatement Funding Advisory Committee, who just met this past week, and they're getting their feet under them. We're going to be getting funding, probably $1 million to $1.5 million a year for the next 15 years. And so the strategies and proposals, what I challenged them to do was look at things like the core program, look throughout the other counties in Florida, what is being successful, what involves metrics and metrics and performance measures, what could be looked at is not just throwing money away, but actually implementing something that has case management with it.
Yes.
And I think the core program does that. I think that's an important component. I can tell you just for me and my family, we've gone through something we've gone through a family member with drug addiction, and it's not a victimless crime. It really isn't.
It isn't.
And I think you can look to the judicial system. I mean, you have your brother, Judge Burgash, who runs Veterans Court. We have Drug Court, and those programs have case management with them. And it's a very important component. But do I think we can fix this and gain traction? Absolutely, I believe we can.
Well, I'm all in, and whatever we can do from the county, you're going to have my vote, and I'm certain that you'd probably have a unanimous vote. Again, an hour goes by quick, but I really appreciate each of you taking your time. I think this is important to have these conversations. And Chandra, one final thing, you said you have a marketing wing, or what was that? Are you going to put like a 1-800 number out for folks? And if so, are you going to be able to market it? Will you have a budget to market it? Because if I can help in that way, maybe we can put it on our county website, or maybe even use some discretionary money to get some ads, or I'll be willing to call Cox and see if they could donate some. I mean, I want to help get the message out, I guess is what I'm saying. Do you have the in-house organic capability to produce commercials or something like that?
Well, we don't have the in-house capability to produce commercials, but I do have a full-time PIO and communications director that are dedicated to just helping get messages out. So we definitely will make a connection with county's PIO, our PIO, and certainly our partners PIO, because, you know, this is, even though we're all separate entities, we're all wearing the badge of the core program. So we
Right
want to
on.
make sure that, you know, as we launch this, that all of our communications folks are standing in alignment.
Fantastic, fantastic. Well, again, to each of you, thank you for being here. Thank you for what you do. And I hope you all have a great rest of the week. And we'll see you guys 1 month from today. We're going to talk about schools, Warrington Middle, Warrington Elementary, with the chairman of the school board. And that's going to be a great coffee. I can't wait. I've got a list of questions. It's going to be fantastic. So everyone have a great rest of the day. I appreciate everyone online who paid attention and tuned in and gave me a bunch of great questions. And I didn't get to ask most of them, but I'll try and answer them. And thanks again. Everyone have a great day.